this is the video for MA 130 respiratory testing using a spirometer. This is the second type of spirometer that we have. So we're going to go through the steps of that particular competency checkoff. Okay, the first step, as usual, is to wash hands and gather equipment. So again, like with all of your competencies, you will go to the other room and physically do a medical aseptic hand wash. When you come back, you're going to gather your equipment. The equipment that you need to gather is one of these spirometers, which is a smaller portable spirometer than the first video. The other things that you're going to need again is a patient chart, a blank encounter form, a black pen, the mouthpiece for this type of spirometer, and the nose clamp. You also again want to make sure that you have a chair for your patient in case they need to sit down. Okay, so that takes care of step one. Step two then is to identify the patient and explain the procedure. So our patient again is going to be Erin Woods. Erin Woods. Hi Erin, how are you today?
I'm very good. How are you?
Good, thanks. All right, Erin, you want to have a seat for me, please? Great, thanks. Now, Erin, I just need you to tell me what your birthday is.
April 10th, 2003.
All right, perfect. That's what I have in your chart as well. So today the doctor has ordered a spirometry test, okay? And that's just a simple test for your lungs, okay? It won't take us very long. I'm just going to have you do some breathing, okay? All right, so again, all I've done is told her that we're going to do a test and that the test has to do with her lungs. I'll give her specific instructions a little later. All right, so the first thing I need to do, or the next thing I need to do is correctly put information into the spirometer. This spirometer is a little different, so we're going to turn the button on, and then there is a stylus here at the end. So with this spirometer, what we are going to start with is we're going to do the test first instead of patient information. So I'm going to hit FBC. We always do the FBC test. That is the test that is most commonly done in the office, so that's what we're going to start with. Just like with the other spirometer, we're not going to do ID1. We're going to start with patient's name, and then we're going to put the patient's name in here. Just a second, and then second column for last name. Okay, once I have that patient information, then I'm going to hit this enter sign here. And then it's going to ask me a little bit more information, such as, oh, you know what? Let me go back here a second. Now, up here in this corner, you don't have to worry about this percentage up here. That is an ethnicity calculation, so don't worry about that. But over here on this side, this is the male-female sign. So male is the point up, and female is the circle with the cross underneath. So make sure you have it calculated or set for proper male or female. So then we're going to hit enter. It's going to ask me a few more questions, such as my patient's age. Erin, how old are you?
I'm 11.
So I'm going to put that in. How tall are you, Erin?
About 5 feet.
Okay, so this is going to ask in inches. See here it says inches, so that's 60 inches. And Erin, about how much do you weigh?
Say about 129, 130.
Okay, so we'll put 130 in here. And Erin, do you smoke? We always have to ask our patients if they smoke.
No,
Erin
ma'am.
probably does not. So again, if she did, we would put the years that she smoked in here, and then this C/D is for cigarettes per day. The other thing is technician, first initial, last name. So I have that in there. So all my information is in and complete, and then you'll get a screen that looks like this, and when I'm ready for my patient to do the test, I'm going to hit this right here, which shows kind of a patient sitting at a counter doing a test. So that's going to start my test. So I have all the information in correctly. Now would be the time that I'm going to give my patient their instructions. Same instructions as we did in the first video that I'm going to go through with my patient. Now, one thing, when you put this mouthpiece on, it's going to go on the side that looks like kind of a little turbine, but you have to hold the back side so the cartridge doesn't pop out. So you just slide it in. There's an arrow right here that kind of shows where it goes in. Mouthpiece right in like that, and it's good to go. All right, Erin, for this test, what I need you to do is we are going to have you stand up, okay? Throughout the test, I need you to stay standing up straight for me, if you will, okay? You have a tendency to want to bend over when we blow, but I want you to try and not do that. Just stay straight, okay? Do you have anything in your mouth?
No.
Yep, no gum, candy, cough drops. Great. And any restrictive clothing? Anything tight underneath? No. Okay, great. So when I tell you I'm ready, I'm going to give you this mouthpiece, okay? We're going to put a nose clip on your nose, and I want you to wrap a tight seal around the mouthpiece. For this machine, you're going to take a big breath in while your mouth is on the mouthpiece, as much as you can. Fill your lungs all the way up, okay? Then when you're ready, you're going to blast out as hard and as fast as you can. Okay. So make sure you tell your patient, fill your lungs, tight seal, blast out as hard as you can. Those are required. And I want you to keep blowing even though it feels like you have nothing left inside.
Okay.
Until I tell you to stop, okay? Do you have any questions, Erin?
No.
Okay. All right, we'll go ahead and start the test then. So now I'm going to push the little icon that I showed you earlier, and I'm going to give this to the patient. The only thing I need you to do, Erin, is to keep your fingers away from back here, okay? Whenever you're ready, go ahead and put it in your mouth, then take a big breath in, then blast out, okay?
Okay.
No, okay, go ahead and put it in your mouth. Good tight seal. Oh, hang on 1 second. Let's put your nose clamp on. Let's go ahead and I'll let you do that. Grab that. Let me hold this for you. Sorry. All right, nose clamp on. Now, go ahead and put it in your mouth. Okay, big breath in. As much as you can, blast, blow, blow, push, 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 go, 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 keep going, keep going, keep going, keep going, keep going, a little longer. Okay, stop. All right, good. Now, what I need to do is I need to look on here and see if it was a good test or not, and it looks like it was not, so I would discard this test, and we're going to do another one. Okay, go ahead and put your nose clip on. Are you feeling okay?
Yep.
All right, you did a good job staying up straight, but a bigger breath in if you can, okay, Erin?
Okay.
Okay, put it in your mouth. Okay, great big breath in, and push, blow, 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 keep going, go, 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 keep going, keep going, keep going, okay, stop. All right, good job. Well done. All right. So I have a good test on here this time. So what I'm going to do is keep this particular test, and then I'm going to hit the icon to do another test. But first, I need to check to make sure my patient's okay. Are you feeling okay?
I'm feeling fine.
You did a great test that time, so I want you to do the same thing. Nice big breath in until your lungs are totally full. Good blast out and keep blowing. Okay? Okay. All right, so I hit the icon again. If you'll put your nose clamp on. And I'm going to give you this to hold. Go ahead and put it in your mouth. Okay, big breath in, as much as you can, push, pull, 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 keep going, keep going, keep going, just a little longer, keep going, doing great, just a little longer. Okay, great. Now, you can hear a little beep, so you want the patient to keep blowing until you hear that tiny little beep on the machine, okay? All right, Erin, that was another really good test. That one was the best one so far. We just need one more test to be finished. This machine, you have to do 3 tests, or it won't, at least 3 tests, or it won't let you stop, okay? So, are you feeling okay? Do you need a break?
Nope, I feel okay.
All right, well, let's do this last one. Go ahead and put your nose clamp on.
Sorry.
It's okay. Here you go. Go ahead and put your nose clamp on. The machine is ready when you are. Go ahead and put it in your mouth. All right, big breath in. And push, 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 blow, 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 blow. Keep going, keep going, keep going, keep going. Just a little longer. Keep going. And good. Excellent. Good job. I'll take your nose clamp. You can have a seat and relax. Okay, great. We got good tests here. So now what I'm going to do is I'm going to take the mouthpiece, and it goes in biohazard, so make sure that that gets thrown away properly and that you do that for your checkoff. And for this particular machine, what we're going to do is we have a separate printer cable that we're going for this particular Okay, so for this particular machine, we have just a cable that gets hooked into the printer, and then it's just like a little mini USB plug that goes right into the side of the machine. So I'm going to hook that in, and then my screen on here will say printer connected, and then I'm going to go back to print. This is a print screen, and you want to hit the print with the T in the corner, and that will print my patient's results. So that should be sending it to the printer, and it'll be spitting that information out. Now in the meantime, like with the other one, I'm going to ask my patient, Erin, are you feeling okay?
Yeah.
Doing all right? All right, I'm going to have you sit just a second. Do not let your patient leave until your test is printed. This machine prints on 1 page. So while that printer is spitting out the results, what I want to do is start filling out my encounter form, okay? So the encounter form is going to be filled out just like it was before. In this particular case, my documentation in the chart is going to have date, time, spirometry performed, results, and chart. And the encounter form, again, will look just like the other one. We're going to do date of service, so that would be today's date, patient's name, patient's date of birth. The procedure code is going to be the 99212. In this case, we're going to say my patient had asthma. And then again, the test I performed is spirometry. Okay, so when this is all filled out, I have my test result here because I don't want my patient to leave until I have my test results in case something goes wrong. Now what I can do is go ahead and dismiss my patient. So, all right, Erin, you can go ahead and stand up. Are you still feeling okay?
Yep.
Okay, now this encounter form that I have all filled out, you can take up to front so you can check out. Okay, do you have any questions?
No, ma'am.
Okay, thanks, Erin. All right, now I have my documentation done. My patient is gone. I'm going to turn off my machine. Disconnect it. And make sure that my mouthpiece gets thrown into biohazard. And then the last thing, as usual, I'm going to clean up my room, disinfect it. After my room is disinfected, then I'm going to go do my medical aseptic hand wash in the other room. Okay?